My name is Jamie Barfield. I'm a GP at the Village Medical Centre and I'm also the Deputy Clinical Director for Wallasey Wellbeing Primary Care Network. Jane Fletcher and I had planned to visit all of our practices to meet the staff and discuss primary care networks and how you feel the PCN can support you. However, given the need for social distancing, this video is the next best option. But we're also hoping to virtually attend your clinical meetings over the coming weeks. We think it's really important that everyone feels included in the decisions we make, and we're really interested to hear your opinions. So I wanted to quickly take 5 minutes to talk to you through what PCNs are, a little bit about what's been happening with the Wallasey Wellbeing PCN over the past year, and then what the plans are for the next 4 years and how you can help shape that plan. If you want to cut to the chase though, please fill in the very brief questionnaire that's linked in the description. Otherwise, let me get you up to speed on PCNs. So they were a key part of the NHS long-term plan when it was published in 2019, and they exist to support practices in groups of between 30 to 50,000 patients, and they focus on the service delivery for the wider health of their population. As they're larger than their member practices, they're able to use economies of scale, and they're also intended to improve primary care resilience. The hope is that they help us integrate with the rest of the healthcare system so that primary, secondary and social care can all link together to improve outcomes for all patients. So, what have we been doing over the past year? Well, initially we had to form the PCN from our 6 member practices. We then appointed a clinical director, who is Jane Fletcher from the Village Medical Centre, and we also have a lead practice manager, who's Mel Peters from Manor, and Anita Swift at Somerville takes the lead on our finances as well. Each of your practices has a lead GP who represents you at our monthly meetings and are members of the board. There's also another PCN in Wallasey, and that is North Coast Alliance. So there are a total of 7 PCNs across the Wirral, and we regularly liaise with them as well as sharing best practice and supporting each other. Over the past year, we've done a surprising amount really. Apart from setting up the PCN and employing staff to run it, we've developed lots of services to enhance care for our patients. For example, we've developed a dermatology primary care service that is helping to treat skin issues without needing to be referred to hospital, and our social prescribers have been supporting our most vulnerable patients during the pandemic. All that work obviously needs to be funded, and the funding comes from NHS England. The PCN itself receives £1.50 per patient in the core funding. Practices also receive £1.76 per patient for signing up to be part of the PCN. There's also some funding for extended access, which is £1.45 per patient, which goes directly to the practices. The Enhanced Health in Care Homes initiative also provides £360 per care home patient, partly funded by the CCG. And here we have a list of the currently funded roles in the PCN. We have a clinical director, deputy clinical director, Karen McCabe, who's our lead nurse. We have 2 social prescribers, and we're just about to take on 3 clinical pharmacists employed by WOOF, who are due to start as soon as possible. And these are the activities which we absolutely have to do in order to receive our funding. Over the next year, we're working on the Enhanced Health in Care Home specification, which is well underway, as well as 2 other specifications: structured medication reviews, which our clinical pharmacists will be helping with, and supporting early cancer diagnosis, which includes improving screening uptake in underrepresented groups. I'm also Macmillan GP and GP Lead for Cancer for the CCG, so I'll be speaking to you more about this at another point. Over the next 4 years, there are specifications on personalised care planning, tackling health inequalities and improving cardiovascular health. There's a lot that we need to do to be able to secure this funding, but once we have done that, then that enables us to work on other areas that we think are really important. The big question really is, how can PCNs help you, your patients, your staff and the wider community? I know it's hard to come up with answers to those questions, so what I've tried to do is make it as easy as possible. What I'd like you to do is ask yourselves, what do you think that you and your practice do really well? What are you passionate about? What annoys you? Do you know of inequalities in your area, your patient population? Have you got any thoughts about how we could use scale and collaboration to help? We're really interested in the thoughts of all the staff in your surgery. You can either feed back to your lead GPs or click on the link in the description to fill in brief answers to 5 questions. It's literally just 5 questions. We can then start planning how we might incorporate your views into our plan for the next few years. We can use various different roles to assist with the specifications and help us achieve the goals that we set ourselves. So far, we've employed social prescribers and pharmacists, but as you can see, we have lots of options to choose from. Don't worry too much about how much each role costs, as the PCN board will be carefully considering this. But to give you an idea, there's a lot of additional roles funding. Looking ahead, each year we're due to receive increasing guaranteed funding, so we have a large amount to spend on the PCN over the next 4 years. That's there to help us meet our specifications, to improve the resilience of primary care, and to support those areas where you think we could make a real difference. Very simply, if you have any ideas, questions, or just want to get in touch, then please contact us. For more information, both the BMA and King's Fund have some excellent information on primary care networks. Thanks very much for your time.